in front of you. I got oxygen in the corner. I got some crutches too. So please take your time whenever you're ready.
Okay. Mr. Chairman, members of the committee, Brian McAnallen representing the City of Las Vegas. Senate Bill 60 is the product of a federal program that is designed to move federal dollars to public agencies that do Medicaid transports. In the City of Las Vegas, through our fire and rescue department, we do a number of Medicaid transports. And this would be the opportunity to see federal dollars to help supplement those costs. The way the bill is outlined right now after the first reprint, we attempted to make sure the language in here met with some concerns from the state agency, specifically the Division of Healthcare Financing Administration in HHS, and to make sure that this was a voluntary or permissive program. Down in the City of Las Vegas, if he hasn't been noted yet, sits Chief Steve Smith, former fire chief from Clark County, and has been a consultant to the Fire Chiefs Association as well as the City of Las Vegas on this issue. We have been working for over 2.5 years to kind of build toward this program, and I would be remiss if I didn't call out all the efforts of the state agency and the staff of the state agency, some of which have turned over during this time, but folks who have come together to try to build this program. When we first started heading down the idea of this bill, we were operating under a memorandum of understanding with the agencies through the State Fire Chiefs Association, of which we're all a part of, that would set this program up for statewide implementation and allow departments that met the qualifications to be able to receive these dollars. So I think what you have in front of you is an amendment that we're offering to our own bill, so it's a friendly amendment, from the City of Las Vegas that would further take the first reprint and put more voluntary language in there throughout the bill and to make it permissive. Again, we have come a long way in this process and have been operating under a memorandum of understanding. Our whole goal here was to put down the parameters of the program and to make sure that there were provisions within the bill that said if those federal dollars were to dissipate, dry up, etc., that the state would be held harmless, so there wouldn't be a budgetary impact to the state. That's some of our intent and attempts. And I would ask Chief Smith to weigh in a little bit on the process with the Fire Chiefs Association and where we are. We are continuing to work on a memorandum of understanding for other pieces of the bill, because there are kind of two different programs established in here, a fee-for-service provision and the Medicaid, managed care organization. So since I'm out of breath, I'll ask Chief Smith to weigh in.
Please begin.
Good afternoon, Mr. Chairman. I am Steve Smith, assisting Las Vegas Fire and Rescue and Nevada Fire Chiefs Association. I've been involved in this project since the proposed legislation in 2015 and the MOU that was agreed to between Nevada Fire Chiefs and State Medicaid. All phases of the MOU have been implemented with the CMS approval of the SPA for the Medicaid ground transportation portion that is a fee-for-service side. A part of that MOU also covered the managed care section, which CMS has decided to terminate effective June 30th of this year. And that was the purpose of this bill, to put us in place so we do have a program that helps us cover the cost of managed care recipients that we provide that service to. Not only the City of Las Vegas, but Henderson, City of Henderson Fire Department is also a agency that provides service to managed care providers. So they also would benefit from this legislation.
I would probably close our testimony before we...
And your name again.
I'm sorry, Brian McAnally,
Thank you.
representing the city of Las Vegas, my apologies. Before we would then open ourselves to questions, to say that we are continuing to work with the state agency and the division, and hope to establish other pieces of this bill through a memorandum of understanding. So while we are having a great deal of progress, I would certainly like to keep this bill alive as we move through the process, and we might be able to accomplish things sort of offline and without the legislation.
All right. Well, thank you very much for your presentation, both of you. Appreciate it. Questions from committee? Ms. Titus.
Thank you, Mr. Chair. It was brought to my attention after it was heard on the Senate side that there may be some conflicts with what federal regulations allow. So it's an opportunity to clarify those concerns here, and that's why I'm bringing that up. And it's because of MCOs, or managed care organizations, where you negotiate a contract and you negotiate a fee. And then, at least from a provider standpoint, we're not then allowed to bill for more than what we've negotiated. That's prohibited. And so there's some concerns that this bill then is contrary to what federal regulations have established.
Mr. Chairman, members of the committee, Dr. Titus, Brian McAnally again with the City of Las Vegas. You're right, and I think that's what I was attempting to refer to, and I think Chief Smith was also addressing. So let me try to clarify that, and I believe the agency will come up here. Without putting their words into their mouth, I believe they're testifying in neutral, but we'll have some qualifying statements to make. You're right. There are some federal provisions which expire on June 30th, 2017. That's one of the reasons why we had put in a date for July 1, 2017 to kind of go forward. We are hoping to have a program worked out, and this is one of the MOUs I was referring to, with those managed care organizations to provide that service. But you are absolutely right in your statements and comments about that being the guideline for those dollar amounts and those reimbursements that would be negotiated. And that's really what we're attempting to do, and I think what Chief Smith was also referring to. And that is one of the reasons why we're able to continue having those conversations. In the end, this bill may not be necessary.
Thank you for that, Mr. Chair. If I might just then do a follow-up on that then. So if the federal law proceeds and you get these MOUs, this bill will not be needed? It will take care of itself, the issue? Is that what I'm hearing you say?
Mr. Chairman, again, Brian McAnally, that would be our hope. Yeah.
Thank you.
Thank you, Ms. Titus. You actually cleared some stuff up for me too, so I appreciate that. Mr. Thompson.
Thank you, Mr. Chair. So my question, I want to kind of visualize this. So say that it's a person, indigent person, they are on Medicaid, or a homeless person, and there's a need for EMT services because it happens all the time. Is there anywhere here in the proposed amendment that, should this be accepted in the plan, that it's looking at that it's medically necessary and that it is a substantiated emergency? Because sometimes you have an abundance. A good example is when UMC used to be the county indigent hospital only. That's where people went if they had just a basic cold and so on and so forth. So is there any measures in this amendment that states that it will have to be either medically necessary or defines an emergency?
Mr. Chairman, members of the committee, Brian McAnally, I'm going to continue looking through the bill to see if there are specific points where it spells out those type of requirements. I would suggest that I think the bill is more of an umbrella in nature and would allow for those specific elements to be defined through the state plan amendment and through the relationships with the providers, which in this case would be Las Vegas and Fire and Rescue, and those parameters. We couldn't certainly bill for something that wouldn't meet requirements of the federal definitions and the federal guidelines for this program, but I don't believe in the bill we spell out at that level of specificity that you're asking for. But I will also defer to Chief Smith down in Las Vegas to see if he can weigh in on that a little bit further.
Good afternoon, this is Chief Smith again. No, the bill doesn't weigh that out, but the state, the government entity would have to provide all of the medical information to the state for their review before the payment is approved. So again, there's a review process of all services that we would provide. So we still would provide this service. We submit the data to the state, and they will review it. In the agreements that we currently have with the MCO providers, it's clearly written that it has to be medically necessary. So it's not in the law, but it's in the contracts that I have reviewed with the MCOs that the city of Las Vegas currently has with their managed care providers.
Okay, so you gave an example of the city of Las Vegas. Will this actually affect counties? Will it affect other cities? So on and so forth. So will they be able to design the contract according to how Mr. Smith stated that that's just that negotiating factor with HHS?
Mr. Chairman, members of the committee, Brian Mackinon, City of Las Vegas. There are, by the elements that establish this program through Centers for Medicaid and Medicare Services, CMS as it's commonly known, that establish the parameters for this program, and public providers of emergency transport have to meet specific qualifications to then be a part of this program. Currently, it is just the City of Las Vegas and Henderson that meet those requirements and definitions at the moment. However, we put together the MOU through the Fire Chiefs Association that would broadly allow for other departments and other agencies, if they met those categories and number of transports, et cetera, that could fall into this program. So it isn't limited just to us by design. It just happens to be by practice and operation that we, at the moment, are the only providers that fall under that category. It would be our hope that more providers throughout the state would also fall into this program, and I think certainly that's one of the reasons why collectively through the Fire Chiefs Association that represents fire departments throughout the state ended up becoming the lead on this. I will tell you to further that, or to hopefully provide some understanding. In the 2015 session, a draft bill came out, I believe it was AB 331 at the time, which was Marilyn Kirkpatrick's bill. And it was designed along the same way, much of the same language you see in front of you. And as we were working with the agency through developing the idea of an MOU, we pulled that bill back as it was up against deadlines. We brought this forward as one of the City of Las Vegas's 3 PDRs, just to ensure that the program was operational. And as we were going through this, we were still kind of in the throes of getting it up and running, and also getting the certification from CMS through the state plan amendments. So our goal with this was to make sure that the pieces of the program were there, and that's another reason why I think as things are falling together, we have the MOUs, we've been working with the state agency, that in the end game here, this bill may be able to go away, and that would certainly be our hope. But in the meantime, that's why it's in front of you, and that's what we're asking for.
Thank you,
Mr. Thompson. Other questions from committee? All right, thank you very much for your presentation. Appreciate you hustling up here to give it.
Thank you.
We do appreciate that. Anyone here in support for Senate Bill 60 that should